Laser because there is no laser pointer. Just sorry.
Okay. वो माइक बंद करा लो. Yeah.
Okay, so good evening, everyone. Today is a special set colloquium day, special because it has been organized on a non-Friday, and also not at 4 o'clock. So the reason is today is World's Mental Health Day. To commemorate this event, the asset is organizing this very special colloquium by Dr. Vihang, Vahia, who is going to talk on surviving success. Firstly, before even I invite Dr. Sandhya Raghavan, I would like to thank on behalf of ASSET, Sandeep Juneja, who has proposed this particular talk. And of course, I also want to thank Mayank Vahia to distinguish it with our own Vahia to make this happen. Without taking more of your time, I request Dr. Sandhya Raghavan, Medical Officer, TIFR, to formally to say a few words about the significance of today's this particular day, including its theme for this particular year, and also formally introduce our speaker. Thank you.
Good afternoon, everyone. So welcome to this special asset on World Mental Health Day. At the outset, I would like to thank Dr. Satyanarayana for giving me this opportunity. As you are aware, 10th October every year is celebrated as World Mental Health Day. The purpose or the aim of this celebration is to improve knowledge, raise awareness, and promote and protect everybody's mental health. The theme this year is mental health is a basic or universal human right. Right to accessible, affordable, acceptable, and good quality care. Right to equality, liberation, and independence and inclusion in the community. So we all know that mental health or good mental health is a vital part of overall health and well-being. Globally, 1 in 8 people are living with some mental health issues. And mental health issues affect or have a huge impact on individuals' physical well-being and health, as well as social life and occupation. And nowadays, the mental health issues are increasing in young adults as well as adolescents also. And post-COVID, we have seen a surge in mental health issues in all age groups. So just having a mental health issue should never be a reason to discriminate. But this we all know, but overall, all over the world, people with mental health conditions have to experience some amount of discrimination and exclusion. I would like to appeal to all of you, don't neglect your mental health and be vigilant and aware about mental health issues. So having said that, what would be more appropriate to celebrate this occasion than to listen to a person who has nearly 40 years of experience in treating people with mental health issues. I'm very happy to introduce Dr. Vihang Vahia, sir. He is an eminent psychiatrist in Mumbai. Dr. Vahia is an international distinguished fellow of American Psychiatric Association. He is Professor Emeritus of Psychiatry, Dr. R.N. Cooper Municipal General Hospital and HPT Medical College, Mumbai. Founder, HOD, Department of Psychological Medicine, Cooper Hospital, Mumbai. Former Professor of Psychiatry, Cooper Hospital and St. G.S. Medical College, Mumbai. He is a consultant psychiatrist in Bridge Candy and Lilavati hospitals, and also he visits Masina Hospital, Mumbai. He is a member, National Advisory Board, Indian Association of Private Psychiatry, former international member, Membership Committee, American Psychiatric Association. He is a Life Fellow of Indian Psychiatric Society, Life Fellow of Association of Private Psychiatry. He is a former chairman, Psychopharmacology Section, IPS, former chairman, CME Committee of the Indian Psychiatric Society. He is former chairman, CME Committee of the Indian Association of Private Psychiatry, member, Positive Psychiatry Section, World Psychiatric Association. He is founder, managing trustee, and CEO of Dr. N.S. Vahia Foundation, Mumbai. He is a past secretary, Indian Psychiatric Society. He has several publications in indexed medical journals, chapters in textbooks, and monograms. Now, without further delay, I invite Dr. Vahia to give his talk, Surviving Success. Thank you.
That I gave my brief CV when it was asked, none of what was said matters at all, so just ignore it. What matters is that I am a Vahia. And taking a line of Mayank's statement, we are just the two of us. So this epidemic of Vahia in your lives will stop today. He's the younger one, but better known, and he's achieved much more than most of us in the family. I have no conflict of interest in making this presentation. Just think of these magnificent institution. Every single graduate of science in adolescence dreams of joining this institution. The institution would have nothing but the very best. That's how I was kept out, but mine came in. Entering these portals was the real success everyone looked for. I'm going to try and talk to you about how to survive what you guys have created for yourselves. Think of your first day where you got the last degree. It was a wonderful experience. There's a great sense of achievement when you joined TIFR. Everyone heard every word you said. Videos were made, selfies were taken, and everyone came to know that you have achieved this. Unfortunately, this epitome of success wasn't universal. You soon realized there was a bunch of people who just refused to accept your proclaimed superiority over them. And then there was always this devil's advocate round the corner, making your life miserable. Whether there was the establishment clerk at the TIFR, or whether it was the canteen manager, and if everything worked out, the mother-in-law. Always out there to make your lives miserable. And then you soon found that success was easy. Surviving success is difficult. Each one of us, beyond post-graduation or even during your training period, we are working seats of our pants simply to survive, simply to remain afloat. There's absolutely nothing that puts us at rest and enjoy. So how do we survive success? First question is, what is success? Proverbially, success means popularity, promotion, prosperity, power, owning a property, or any of those worldly possessions. Success is a relative term. The more you succeed, more relatives will crop up. Success can be a noun, an adjective, or a verb. As a noun, it is hitting a masterstroke, checkmate someone, upper hand. As an adjective, it is conquering, being victorious, etc. These are the measures of success. As a verb, it means something different. Not only something positive that you do for yourselves in your life, but not allowing someone else to do positive is also success. मैंने तो नहीं किया मगर उसको भी नहीं करने दिया. Is also success. So success then becomes the means of achieving whatever that we wanted. It doesn't always have to be positive. And why do we do this? Human race is destined never to rest. Right from the third month, none of us would remember this. Third month of conception inside the mother's womb, the kid always moves around, kicks the mother for the rest of the life. Keeps doing this all the time. Because we as humans just cannot rest. When we sleep, we dream. We have to do something all the time. You cannot survive without doing something all the time. We are perpetually insecure. If you want to upset someone when you're traveling by the train, if there's a lady sitting across, just stare at her. Don't do anything. Just stare at her. She'll pull down the dress, make sure that if there's a gentleman around and you just look at him, don't do anything, just stare. If he has more hair, he'll smooth his hair, button the shirt, whatever. You just cannot settle for doing nothing or not being examined or inspected. We have to do something all the time. And when we can't do anything or there's nothing to be done and this life is completely blank, unless you're a politician, you become completely, so totally lost. A life without needs and generates anxiety and gives a very peculiar pain. So what are the things that we need to do? Sigmund Freud said, like there is a sinoatrial node in the heart which keeps on throwing cardiac impulse at the rate of anywhere between 60 to 120 times a minute. There is something in our coconut that keeps on throwing wants. All the time we want. We want. There's never a moment in our life when we don't want. Right? So, what are the biological instincts? Food, clothing, shelter, and approval. Everyone wants to be approved. We count, we go any amount of distance just so that people should say, wow. Everyone wants to be approved. Think of yourself. If you don't turn up in the institute for a month and when you come a month later, nobody has missed you, it's going to pain. We want approval and acceptance. Then there are sexual instincts. When Sigmund Freud, every time it's a sexual instinct, everybody's, there's sparkle in the eyes. When Sigmund Freud said sexual instinct, it did not mean two individuals and acrobatics. It essentially meant a kind of physical stimulation or a caring and sharing relationship. It's important to have some kind of a physical stimulation. In a country like ours, where you get too much of touch and physical stimulation all the time, we greet with a distant namaste. But in countries which are less densely populated, even the very physical social interaction is ritualistic into hugs and kisses, and lesser the population, more elaborate the social greetings. Because it's important to have touch and caring and sharing relationship. Then aggressive instinct. When I say aggressive instinct, it's not like Palestine and Israel. It's that need to drive. I will do it. I can do it and I must do it and I'm gonna do it. That drive, motivation and achieve and an ambition to reach some place. And then there is this eros and everybody wants to survive, but everybody wants to take, get into adventures also. So film industry has done a big job. They put on the screen most dreadful scenes and everybody goes to see just to get that sense of achievement or adventure, only sitting on the chairs. So, what do we do to fulfill these needs for approval? Guys like me are always willing to travel wherever to give a colloquium. You just call me and I'll be there. And most of us will be there. They're just waiting to be called. There are those who just work. The workaholics, the type A personalities, who refuse to accept that they need to look after themselves or that there is life beyond work. The workaholics, type A personalities. And then there's that entire middle class. They repeatedly do the same thing again and again without any scope, any prospect of promotion, pleasure, prosperity, power. They just do it because it's been ingrained into them that they have to do it. And then there are those amongst us who are the think tanks, who sit and think, usually positive, but a large amount of time spent in finding faults with everyone else. And the lucky ones amongst us get to do something a little more pleasant. The point is, whenever we do whatever that we do, we either succeed or we fail. If we succeed, we feel happy. If we fail, we feel sad. Because nothing succeeds like success, and failure is a prelude to ridicule, redundancy, and a source of distress. There was this gentleman who was very upset 2 days after the demise of his mother. And he's sitting in the canteen and he was unconsolably crying. And somebody said, "Why are you depressed?" So he said, "Well, my mother died 2 days back and I'm feeling terribly lonely." He said, "Why, you had a vivacious girlfriend?" He said, "Yeah, since this morning she's my stepmother." So failure to succeed brings sadness. What happens when a person fails? You feel anxious, sad, frustrated, depressed. There's a feeling of inadequacy. Where did things go wrong? Who's to blame? Why always me? मेरे ही साथ क्यों ऐसा होता है? सबका अच्छा है, मेरा ही क्यों? When will this end? And what are my options? My submission to you today afternoon is that success itself is self-defeating. Why? Because success brings vacuum. You struggle to achieve something, you got it, and then you don't know what to do next. The classical example is a Bank of India deputy manager who fought all cases, went to the Supreme Court, got himself appointed to the rank of a manager. He was transferred from interiors of Maharashtra to the head office in Nariman Point. He was supposed to report for duty at 10:30. He went at 10:15 and he just didn't know what to do. He jumped off at 10:30, he was dead. A vacuum of success. After I succeed, what do I do next? Till I am a research scholar, I at least get my stipend. Now that I've got my degree, no stipend also. So what do I do next? There's a vacuum. There's a monotony. The higher you rise, the more monotonous is your life. You're doing the same thing again and again. In medical world, I would say if you're a specialist and if you see 100 patients a day, you're not seeing 100 cases. You are seeing one case 100 times. There's a monotony. And there is loneliness. We talked about the loneliness when you were having lunch this morning. Amongst the intellectuals, where it's solitary occupation, you're doing everything by yourself. There's all that you do, and now especially with the computers and internet, it's you and your machine. There are people who have not gone out of the house because they got the food from Swiggy and they got everything else, and because they're a wonderful machine that responded, they didn't even want a live person next to them. Alienation. If there is one senior post, 5 people apply for it, one person gets it. At one stroke, that person has got 4 enemies. One stroke. So you don't enjoy your promotion, but you're petrified that you now got 4 enemies. And then there is insecurity. There's fear of treachery. When will someone let me down? When will I be a victim of jealousies? So success is self-defeating. There's a feeling of losing that precious attainment, and there is an overpowering need to perpetuate the success. I should stand first in my class, and I'll marry the person who stood second, not one above me. Now, my children should stand first in their class. Nahi to khandan ki izzat ka sawal hai. You have to perpetuate the success of the family. So what happens when a person succeeds? There's anxiety, and to multiply the success, there's a nagging fear of failure. What if somewhere I fail? Preoccupation with where do I go from here? Who do I trust? The higher you rise, the less you trust. Why do only I have to go through this? Speaking strictly of me, by the time I finished my medical graduation, my classmates were married, had 2 children, and they were officers. After they having done that, she would agree. BSc and things like that. They didn't go through the gruel of 5.5 years. 3 years, graduate, get married, have 2 children. Wonderful. So, when you compare the sequel of failure versus sequel of success, the results aren't much different. That feeling of inadequacy is replaced by fear of failure. Everything else remains the same. So what do you get when you succeed? Well, a lot of things happen. Whether you succeed or whether you fail, the bottom line is human life is born to be stressed. You cannot have life without stress. So much so that if there is no stress, the complacence makes you say things as a political leader which makes everyone else laugh. You have to have stress. If you don't have stress, life will be so dry, drab, and complacent. You have to have stress in your life. Stress is not a disease. Stress is not abnormal. The way we respond to it makes it abnormal. You have to have stress. You have to have blood pressure. Blood pressure is good. Only when it is high, it's bad. Right? If blood pressure is zero, it's death. Stress is like blood pressure. You have to have optimal stress, like optimal blood pressure. If the blood pressure is zero, you're dead. If it is 200, you're about to die. So you have to have that optimal stress. What is the source of stress? Remember, history of stress is as old as history of mankind. Every single religion, every single philosophy in the world has step-by-step stress relieving rituals. Name it. Sanatan Hindu Dharma, more than 5,000 years. Step-by-step rituals for stress relief. The source of stress has changed. The quality of stress hasn't changed. 5,000 years ago, human race was struggling for safe water and saving from wild animals. Today, we drink bottled water out of the bottles and try to save ourselves from wild politicians. It's more or less the same. Every religion advocates some exercise and step-by-step ritual for stress reduction. I heard this in 2005. Professor Nesse gave 6 sources. I have added 2 more. Why does this happen? Because we have our priorities and pulls in life. What we want for ourselves, what our status demands, we do. And very much a cultural variable is our occupation. You cannot, you're holding this position. You cannot dress like that. Or you cannot behave like that. Add to that, what happens is your mate. There are spiritual needs. If you are not spiritual, your mate would be. Material needs of our life. What the friends want. And above all, what the children dictate. This relationship is not simple. It's not unimodal. It's not simple. It is not mutually exclusive. What is good for a person, for the personal needs, is bad for the mate. And what's good for the mate is bad for the friends. And what's good for the friends is bad for your status. And what's good for your status is bad for your children. Oh my God, this whole interaction is so intense. It's such a bad, huge web of mutually exclusive needs. And then, after hearing Professor Ness, I always wonder that it's a small miracle that some of us can even claim to have retained our sanity. What are the model, the biopsychosocial model of distress? Somebody said we should call it psychosocial. And when I say bico, it's not the female spouse, it could be either. Psychosocial model of distress. One is personality. Then genetics. Some of us are genetically prone to being anxious. And then viral fear, premenstrual tensions, which males can't have, illness, fatigue. All this make us vulnerable to anxiety. Then there are psychosocial factors. What will others say? That fear of being evaluated by others, not your HOD, anybody, society, everyone. What log mere baare mein kya kahenge? That's such a fearful stress. Log kya kahenge? And then family and peer group. There are patterns of friend circles. There are pressures and there are prestige. He drinks 5 beers. So, okay, to prove my masculinity, I'll have 8. Peer pressures. That person do that, so I must do something better. If there's something positive, that's fine. If something negative, it's terrible. And then there are ratios of demand and supply. There is always more demand than supply, no matter what you mean. Competition today in the world, unless you get 120 out of 100, you are good for nothing. Changing norms and temptations versus morality. The biggest problem of educated middle class or upper middle class population is I'm tempted to do, but morality would not. Talking of personal factors of stress, Professor Linford Rees cited this case in his presidential address of stress stresses and stress mechanisms to the Royal College of Psychiatrists. So he had a young man who presented to him with treatment-resistant headache. Whatever headache just wouldn't go. So at some point in time, Professor Linford said, okay, what is the problem in your life? He said, it's tension at my job. Okay. What's your job? My job is that I'm a fruit vendor's helper. You're a fruit vendor's helper. What is so stressful about it? What do you actually do? What is the job that you do? He says, I separate large oranges from small oranges. And that's terribly stressful. So, okay, why do you say so? He says, sir, don't you realize it is all the time decisions and decisions and decisions all the time. Every time he picked up an orange, he had to decide whether this was a large orange or a small orange. There are no absolute measures by the smell, color, or the weight. It was entirely personal decision of whether this was a large orange or a small orange. And that gave him treatment-resistant headache. So what is stress? Everything is stress. The biggest stress is maintain sameness. I take the bus at 9:20. The 9:20 bus is cancelled. Oh my God, what's going to happen? This happens particularly when the situation is fulfilling. The trouble is, the only certainty in life is that life is uncertain. That's the only certainty in life which none of us is willing to accept. So, other major stress is dealing with the uncertainties of daily life. All of us are living in uncertain times. We just don't know what's going to happen the next moment. In TIFR campus, you are safe. When you go out in the world, open world, you'll realize the uncertainties are infinite. And you just don't know how to prioritize your life. What comes first? Job, spouse, old friend, neighbors, family, parents. You just don't know how to, children. You just don't know how to prioritize your life, no matter what. And everybody will say, you give me more time. And after that, you do what you want. I have patients who would come and say, doctor, you're looking very tired. You give me enough time, but you can cancel the other appointments. Prioritize life. For achievers like you guys, the source of stress is differentiating between needs and greed. Fantasies and realities. Dealing with the opportunities when you have more than one. Issues of sexuality, I'm not even going to get into that, but that's become a huge issue now. And of course, dealing with the temptation. I'm tempted to do it. I can't because of whatever reasons. So what are the symptoms? Symptoms of stress, response to stress of two kinds, eustress and distress. Eustress is the optimal response to stress. When the examination timetables are announced, or when you are told you have got to do a colloquium, or you're told that you're going to be interviewed, you suddenly become more active. You know, you have got to defend your thesis. You become more active. All those things that you had read 5 years ago start coming back to your memory, though you don't even remember that you had read that. Suddenly, person becomes more active, and positively, the association between past memories and the present thoughts improve. But then there is distress, and the symptoms of distress are feeling anxious and worried, restlessness, irritability, fatigue, muscle tension, poor concentration, DIMS, that is disorder of initiating and maintaining sleep. I can't get sleep, or if I get sleep, I keep waking up, or disorder of excessive somnolence. Pada rehna hai, kuch nahi karna hai. I don't want to go to the institute. Let everything go to hell. I'm just not going to get out of bed. Today, in the educated society, this has become a status symbol. It's a fashionable thing to say, I'm anxious and worried. What about nothing but I'm anxious and worried? Or I'm so uneasy, I can't sit steady and I get very angry, and don't irritate me because I'm terribly tired. And then I have muscle aches and pains. I need to take an aspirin every 2 hours because I got total body ache. I must go for massage. I can't concentrate on my things because I'm so upset and angry. And I'm not able to sleep unless I take a sleeping pill. Today, in a city like Bombay, if you're not anxious, if you're not worried, you're not restless, you're not irritable, you're not tired all the time, you enjoy your work, you're able to focus on what you're doing, something's wrong with you. That is the status symbol of today. And what happens is, just like stress induces distress, distress induces stress. Each one of us in this house, each one of us, we have put ourselves in this unending, self-perpetuating, lifelong cycle of stress and distress. And we have done this ourselves, voluntarily. And at some point in time, we were proud that we have done it to ourselves. So, what are the manifestations? There are people who just refuse. How can I be under stress? I'm such a nice person. I'm such an authoritarian person. I've got 20,000 people working under me. At one command, Prime Minister changes his priorities. How can I be under stress? These people have changes in personality. The people who are very talkative just become, they start sulking and they become quiet. Kya ho gaya? Kuch nahi. Baat kyun nahi karte? Kuch nahi. You are not your usual talkative self. Leave me alone. Bottlers and blowers who make everybody else sulk. They yell, scream and shout at the top of a head. Then physical illnesses, blood pressure, diabetes, hypertension, irregular pulse rate, muscle aches and pains, menstrual disorders, chronic backache, chronic headache, loss of appetite, libido and loss of sleep. This loss of appetite, loss of sleep and loss of libido should be generalized. There is a story of a gentleman who went to a doctor and said, "Doctor, I have lost my libido, so please give me some Viagra." And the doctor gave him Viagra and he said, "I want to surprise my wife." So wife said she was going out to buy some vegetables and he took the Viagra and got all ready within half an hour for the wife to come back and surprise us. The wife met a school friend of hers and she decided to go for a movie. So she phoned the husband that, "Look, I'm going to come after 4 hours." And this man was all charged and ready. He phoned up the doctor. He said, "Now I'm all charged and ready, but she's not coming for 4 hours. What happens?" He says, "Nothing, 4 hours, I'm the effect will wear off. But after a long time, I'm feeling so good. What can I do?" So I'll ask if there is some other lady around who's willing to cooperate. So the only lady in the house is my maid servant. So ask her. He says, "But with her, I don't need Viagra." So it should be something which is pervasive. And then accident proneness. People who become workaholics or look for some reason to get a kick out of a drug or alcohol. And then there are sex-related misadventures in people who are high profile. Remember our Uncle Bill and Auntie Monica and the sexual misadventures. And there is increased religiousness. Come exam and people start visiting temples. When the SSC exam comes up, you can't put your foot into Siddhivinayak temple. So, what are the consequences? Hypertension, diabetes, coronary heart disease, accident proneness, malignancies, she would know more. Changes in personality, unpredictable behavior, indecisiveness, sleep-inducing pill use, sildenafil, Viagra use, or other substance use. And most troublesome is changes in interpersonal relationship. People find it difficult to retain a friend, marriages break up, people just can't get along with life. So then, what is the solution? Solution is accept that you have stress, that you can't have life without stress. What time? Do I have 10 minutes more? 5 minutes? Yeah. You can't have life without stress. Accept that. Please accept that you are not a politician who's trying to just fool people. You have to have stress to survive. Higher the intellect, higher the level of stress. Stress is not abnormal. It's important to have stress. Stress is essential. It's the way we respond to stress that makes it abnormal. So, what are the remedial actions? Time management. There are 24 hours to a day, no matter who you are and what you are. And the ideal way is divide these 24 hours into spells of 8 hours each. 8 hours of work, 8 hours of sleep, and 8 hours of looking after yourself or your family. So people say, "I can't have 8 hours of sleep. I'm so overworked." Well, the more overworked you are, the more you need to sleep. 8 hours of sleep, of which at least 6 hours should be in complete darkness. So the fashion, with the artificial light, 12 o'clock in the afternoon and 12 o'clock at night are equally bright. So people then take pride in saying, oh, I go to sleep at 4 o'clock and wake up by midday. Well, that's not the way human bodies are made. Human bodies are made physiologically to sleep after sunset and wake up by the sunrise. We are not owls or big cats, lions and tigers who can sleep till midday and still be happy. We are humans and not politicians. We are humans. We have to accept that we have to have 8 hours of sleep, of which 6 hours should be in complete darkness. If you can't manage that, it should be 55. The equation is 55 to 60 hours of sleep per week. So if you can sleep for 24 hours of Saturday and 24 hours of Sunday and make that 48 hours, you can cut down your other daily sleep, which doesn't work out. So it's 8 hours of sleep, 7 days a week. There is no compromise. Restructure your life. Set your priorities. Set your goals. And no matter what you plan, you must have a plan B for everything. You must have a plan B for everything that you do. I'm madly in love. I want to marry him or her, but if that doesn't happen, the sibling is okay. You have to have a plan B. No matter what you do, you must have a plan B. And develop that art of listening. At some point in time, if I get an, there are 9 ways of listening. Listening with the extra, when you're driving the car, you have switched on the radio, you are singing that, you're humming that song with the radio. 2 minutes later, if somebody says, "Kaun sa gana tha?" you won't remember. That's listening with the external ear. Then there's listening with the internal ear. When somebody comes and tells you, "I've got this problem," and keeps on repeating, the person is telling herself or himself that, "Look, I have this problem." And then there are 9 ways of listening, but the most important is listening with the third ear, not the eye, third ear. The speed at which a normal, average intelligent man who's wide awake can think is 600 words a minute. The speed at which we communicate is ideal, should be 100 words a minute. Some of the Americans speak at about 80 words a minute. Indians, amongst the Indians, Gujaratis and Malayalis speak very fast, about 150 words a minute. But even if you are a Gujarati like me or a Malayali, speak at 150 words a minute. The rate at which we think is 600 words a minute. So there's a bow effect. When you're communicating with something or someone, if you're not able to engage that person in your conversation, the attention drifts out and then comes back. So if you want to be understood, speak at approximately 80 to 100 words a minute so that you are understood and you make sure that the other person is able to tell you what the person has understood. It's important, and it's important to make sure that other person clearly understands what you have said. When I was a second MBBS student, oral contraceptives had just been introduced in public hospitals. And our honored gynecologist said, "Come on, students, I'm going to teach you how to give instruction on the use of oral contraceptives." This was at Vahia hospital. So we had a gentleman from Varanasi, and he sat down, he and his wife, and my doctor said, "Dekho Pandit ji, रोज ये दवाई खाने का, समझा?" "हाँ साहब समझा." "वो सो गया होगा तो उठा के देने का, समझा?" "हाँ साहब समझा." "खाना नहीं खाया होगा तो भी दवाई देने का, समझा?" "हाँ साहब समझा." "सर्दी खांसी कुछ भी होगा तो भी दवाई देने का, समझा?" "हाँ साहब समझा." "घर में कोई मेहमान आया होगा तो भी दवाई देने का, समझा?" "हाँ साहब समझा." "रिश्ता नहीं करने का होगा तो भी दवाई देने का, समझा?" "हाँ समझा." Went on for 10 minutes. After 10 minutes says, "डॉक्टर साहब आप कोई फिक्र मत करो, जिस दिन वो दवाई नहीं खाएगी वो दिन मैं खा लेगा." So it's important to make sure that you have proper understanding and you communicate well. It's a question of attitudes. Anytime anything goes wrong, we all get together and say, who's to blame? ऐसा किया, वैसा किया, अरे बॉस ऐसा बोला, ऐसा कैसा बोला? We spend so much of time in finding out explanations and excuses. But क्यों ऐसा हुआ? हम बीमार क्यों पड़ा? Etc. A real adaptive attitude is action. जो हुआ सो हुआ. What next? Find a solution. Don't waste your time finding faults or blaming others. What are the factors that we need to balance? Sleep, diet, exercise, sports, meditation, and environmental factors. There's a lot written on meditation. She would tell you all about it. For those who don't have that intellect to meditate, guys like me, the best is to go and take a 45-minute walk every morning and evening. There is science that if we take a walk for 45 minutes twice a day, especially the 45 minutes in the morning, at a pace which does not make us breathless. The marker in the colder countries is walk at a pace where you don't sweat, but we sweat every 5 steps. So sweating is not a good marker. For us, the marker is walk at a pace where you don't get breathless. And when we do that, we generate endorphins in our system. Endorphins are the nature's chemical of happiness. When you start going to the gym and do the cardios and cycling and jogging, you activate adrenaline. That makes you a good soldier. It increases resilience. But you are looking for happiness. Walk at a pace which does not make you breathless. 45 minutes twice a day, that is a science. Meditation is wonderful. But then it takes common logic to install a home gym, spend money, but it requires deliberate attempt to ignore it. And a whole lot of home gyms are lying idle. And accept or compromise between ambitions and actuals. This is what I want, but that is what I can do. An uncle of mine was very upset when Hema Malini married Dharmendra. He said, if she wanted to marry a married man, why not me? But then you got to have some kind of a compromise between abstract. And remember, if you fill up every forgiving minute with 60 seconds worth of distance run, you will be a coronary before you are 51. Learn, sorry? I hope Kipling forgives me for this. You have to learn to be nice to yourselves. Whatever work you are doing, whatever the family you are looking after, everybody will take care of themselves. Only you can take care of yourself. Learn to be nice to your own selves. And then a stable relationship, and pay attention to time and spend time with the family. There is this case of a young gentleman who, to prove his love and commitment, he climbed tallest of the mountains, swam deepest of the oceans, and crossed longest of the deserts. Yet, she left him simply because he was never home. You have to learn to spend time with yourselves and with your family. So, ladies and gentlemen, I see Mayank shaking his watch. Before it stops, let me say that in life, striving for success is human. Your first step of success is when you entered the TIFR. Believe me, this is just the beginning of successes that lie ahead of you in your years. This is not the end of the success. This is the beginning of successful but yet stressful life. Stress is inevitable. You have to have stress in life. So learn to enjoy it. But if you can't, make sure you don't fall into these shortcuts. I take alcohol to sleep. Alcohol does not produce sleep. The alcohol alters level of consciousness. It does not produce sleep. Sleep is REM and NREM activity. Alcohol blocks NREM. Alcohol does not produce sleep. It takes away your tensions. It changes your level of consciousness. It does not produce sleep. Alcohol is not a sleep-inducing agent. Full stop. No two ways about it. So, other thing is take benzodiazepine. That's become a fashion nowadays. Oh, I take an Alprex. You know, the internet medical graduates, they look at all these and they start taking Alprex or Campos or Ativan. And I love those drugs because they increase my practice. They're terrible. Couple of things happen with Ativan group of drugs. Unlike alcohol, where a person starts with PEG and then increases the quantum, people who take these drugs, they don't increase their quantum, but they cannot do without it. That's one. Two, it produces autobiographical memory lapses. So when a person is habitually taking these sleep-inducing drugs, out of the 10 things that the person has done, will have no recall for 1 or 2, including the promises made to the spouse. 3, it produces state-dependent learning. When you learn something when your brain is benzodiazepinized, you will be able to recall only when the brain is re-benzodiazepinized. It is state-dependent learning. Benzodiazepines relax the people so much that they tend to fall. Almost every single person who comes with a fracture of the leg after the age of 80 would be on a benzodiazepines, which causes the fall. And then the white-collar crimes. A whole lot of white-collar crimes occur because the patient is under benzodiazepines. He knows that person should not be doing it, but anxiety is suppressed and the person goes and does something else. And don't experiment with unsafe sex. How to define unsafe sex is difficult to say, but don't indulge in something that your conscience doesn't agree with you. Though our Uncle Bill and Aunt Monica, their conscience agreed with them, they got into problem. So please avoid a fearful, unsafe sex adventure without any religious commitment or insinuation. 3 nuns were discussing their experience in doing up the the cardinal's bedroom. And the first one said, I was so upset yesterday when I went to sew this bed, I found a bunch of porno magazines. So what did you do? The other 2 asked him. She said, I threw them away. A week later, they met again, and one man said, yesterday when I went to clean the cardinal's room, I found a bunch of condoms. So what did you do? Did you throw them away? So no, I put holes in each of them. And the third nun collapsed. So avoid dealing with unsafe sex. Ladies and gentlemen, if you can't do anything, if you just can't deal with stress, then you should learn to contact your friendly neighborhood psychiatrist. 9821284555. That's my number. And what will the psychiatrist do? First thing is bring about clarity of thought. That muddled thinking has to be spoken out, and the psychiatrist will help you to rewind your thoughts in a more orderly manner. That's the first thing. Otherwise, take medicines. What the medicines would do is initially suppress your symptoms. The science today says that every single brain diseases, anxiety, depression, psychosis, whatever, it is a disease of the brain, full stop, disease of the brain. Anxiety is also disease of the brain. And the science today says that when you start the medicines, you first have symptoms that come under control, but the brain circuits which need to be redesigned take time. And the medicines have to be taken for a long time in the minimum effective dose. Please avoid internet medical graduation. That's probably the worst thing you can do to yourself, ladies and gentlemen. It's time for me to shut up. Thank you.
Thank you, Dr. Vahia, for giving a lot of insights, but also through a lot of fun and humor. But I'm sure there must be a lot of questions on the both audience. Also, I want to take this opportunity also to invite questions from Zoom and YouTube audience. So please raise your hand if you have questions. I'll come back to you.
Delightful to talk about stress. We never laughed so much in a colloquium like this. I just wanted to ask you, you're talking about, people talk of freedom from stress, but I want to address you to address the stress of freedom, the problem of choice, particularly with young people now.
You can't have freedom from stress. You can learn to adapt to
I agree.
stress. So freedom is from distress, not from stress.
I agree, but there are books which are written freedom from stress. I think I understand that now. But I want you to address this fact that when there's so much of choice about everything, about career options, about the way you want to, what you want to do in life, etc., How
The
about
generation
people-
today is in a wonderful position. Whatever they touch turns to gold, provided they persist with it. The tendency today is to find success by yesterday. You don't even want to wait till tomorrow. That haste makes waste. Anything that you touch turns to gold. I'm reminded, since you said, as a young kid, my mother would take me to Crawford Market, essentially to carry the bags. So I would, very like a loyal son, go with my mother to the Crawford Market and have those bags coming around. And there used to be a gentleman whose one leg was amputated. He was on a crutch. He would wait near the police commissioner's office and he would get you a cab. All that you had to do was to tell him where you want to go and wait there, and he would fetch a cab. So you don't have to run around from cabby to get a cab. And he would charge, those were the days of annas, 4 annas from the customer and 4 annas from the cab driver. And that's all. A few years later, we went again. He had put a tea stall. So as you wait for the cab, you also had tea there. And a few months later, there were also biscuits. So you went there and you were trying to get a cab, and then you are having tea and you are having biscuits. And then I joined medical college. So my mother probably took him. That's my brother. Few years later, I had graduated, I had become a full-fledged doctor, and I told mom, okay, I'll come with you. Let's find our friend who gets us a cab. And we went there and we didn't find. The tea stall was there, the biscuits were there, but the gentleman wasn't there. And I asked him, I said, where is the gentleman who was the gentleman with the amputated leg and the crutch? Where he's gone? He says, that restaurant across, he owns that now.
Wow.
Whatever you touch turns to gold with perseverance. And if you want success by yesterday, it's not going to happen. Stress is essential. If you have a life without stress, that's a reason to be worried. I see people who claim to be burnt out by the age of 30, 35. They are the guys who went into these rich, quick money-making businesses and ITs and, sold out there. They set up a new venture, made a lot of money, sold it. After they sold it off, what next? That's complete loss. No stress. There are farmers, we see this in the papers, there are farmers who sold off their farms because they were fed up of various uncertainties in farming. They got a lot of money, spent that money. 2 years, 3 years down the line, the money got spent, and then what? Suicide. So don't even think of a life without stress. And no matter what you plan, always have a plan B.
Thank you.
And thank the stars, thank the Lord, thank your parents that there is stress in your life.
Yeah, here is the question.
Hi, so I actually want to ask a question which we face as students or research scholars very often related to stress. That is, if there is an exam or a presentation or something similar coming up, we feel anxious and we do not sleep. So, and I think most people have that. So is there a way to cope with it?
All right. So what is it that stops you from sleeping?
Maybe thinking about
Not the exam. What stops you from sleeping is your thoughts,
Yeah, most probably.
right? So we blame it on the exams. What stops us from sleeping is thoughts. And the thoughts should come up if there is some sense of insecurity, right? I don't know about TIFR, but at the university level, 60% ignorance is allowed. You only need 40% of marks to pass. Legally, officially, formally, 60% ignorance is allowed. I think at TIFR is 50-60%, something like that. Of that 50%, 25% is chance occurrence. If you have done your general studies and if you have been generally alert and you have not been missing your labs and missing your conferences, 25% is pure common sense of the subject. So you need only 15% knowledge to pass the exam. And if that 15% is keeping you awake, ask yourself why. Unless you're thinking of something else. So the idea has been around for a while, one has to develop a switch on and switch off mechanism. Never carry your work to your hostel and your hostel to your work. Switch off. And anytime a thought comes to your mind, which they will because you're a fertile brain, keep a piece of paper and pencil and note down the thought rather than encouraging the thought. I got this thought. This is the question that's bothering me in mind. Instead of switching on the lights and finding the answer at 2 o'clock in the morning, I'll do that 8 o'clock tomorrow morning.
Okay.
In the 6 hours, nothing is going to be lost. And you have written on a piece of paper on pencil by your bedside. You've taken the thought off your mind and the problem is still not dead from your curriculum. These are some of the things I suggest.
Okay.
Don't take a benzodiazepine
No,
and don't drink yourself to sleep.
No.
Think of something pleasant. Meditation helps.
So, for example, when we are physically ill, we take medicines and all, and we understand that we are getting better. What are the indications of, say, someone who's going to therapy or counseling? When do they start realizing that they are getting better? That's the first question. And second thing, you just mentioned that don't carry your work to home and home to work. In a place like TIFR or institutes where we are living in hostel, essentially we we sleep where we work. So how does one mentally have a separation in between these things?
This is such an individual problem. I wouldn't have an off-the-shelf answer for this. But you got to specify what you're going to do at what point in time. I can only share the experience of somebody working in the US who told me this, that the lab that he was working in biochemistry, molecular biology, and the lab's experiments sometimes demanded that the child should be awake or the student should be awake till odd hours for the experiment to finish. At 2 o'clock in the morning, 3 o'clock in the morning, there were no campus buses. So they were provided with a bed in the lab. Or if the problem was important enough, with the permission of the teachers, they could ask for a taxi, but go home to sleep. So it has to be individualized. When will you start feeling you are good? There is no cut and dry. It's not like fever that, okay, the temperature came down and I'm good. When you're emotionally upset, it's a subjective experience. So when you feel that you are able to cope with your life without getting distressed, with therapy or with medication, that is the point at which we say you're all right. When you take medicine, feeling well and getting well are two different things. You feel well within few days to weeks of medication. That is suppressing the symptoms. Getting well is setting those brain circuits right. That takes months to years, sometimes lifelong. It's like diabetes or blood pressure. If a person has diabetes or blood pressure, you give medication. When the blood sugar comes under control or blood pressure comes under control, you don't stop the medicine. You take the medicine at the minimum effective dose. Same holds true for anxiety, depression, and other illnesses.
Thank you.
What was asked, like when should one seek help? In the sense that usually, if I'm stressed or something, I always think that tomorrow will be better, or I just have to work harder. So when is a good time to think that, okay, now I need to see a psychiatrist?
That's an excellent question. Everyone goes through moments of anxiety and depression. So feeling anxious or feeling depressed is not suffering from anxiety or suffering from depression. If the symptoms persist on most days and most days of the week and most time of the day, consistently for a period of 2 weeks or more, without any elicitable reason, that's the time to seek help. Now, when you say elicitable reasons, it also means dealing with situations which are perpetual, like a child who's abnormal, or like dealing with a spouse who doesn't understand you, or dealing with a situation which is inexplicable. So there is a fear of loss of prestige or loss of possessions or loss of power, which is real. That's the time. And if it persists, that sense of insecurity persists for 2 weeks at a stretch, that's the time to seek intervention. Or it's associated with loss of weight, and loss of appetite, consistent negative dreams, and sometimes a feeling that life is not worth living anymore. I dare say that each one of us in this house had experienced a desire to end their life at some point or the other. Every single living individual after the age of 12 would have experienced at some point in time getting a sense of wanting to end life is normal. So don't get upset at the thought of wanting to end my life, or I feel so distressed that I want to end my life. Very often just talking it out with a close friend who's non-judgmental, talking to a person who's not going to let others know, helps. Times and again, you have patients who say, Doctor, I felt so good talking to you. Other patients say, Saab, aapki shakal dekhi to acha ho gaya. Abhi meri shakal mein koi antidepressant to hai nahi. Magar just that rapport, that someone cares, helps.
I just want your opinion about this PHQ-9 questionnaire.
That's a screening questionnaire.
Yes. So what I have done is I have given access to it on our TIFR website so that people can self-analyze and reach for help. Is it a good idea?
It's an excellent idea, madam. It's such a good idea that at one of the hospitals at Masina, for example, there's a plan to give PHQ to all patients coming to the hospital outside the psychiatry department to find out how many people need mental health care. The data today, there's a PPGHC, Psychological Problems in General Health Care. This was a 1980 study by the WHO, which found that 2 out of every 3 patients that approach any physician, not a psychiatrist, suffering from 2 or more symptoms that require psychiatric help. The only medical field associated with happiness is obstetrics, childbirth.
Yes.
There is no other branch of medicine which is associated with happiness. An acutely manic person might be happy, but the family is upset. So there is nobody ever goes to a doctor for fun. Nobody likes a doctor. Let's face the fact. Nobody likes a doctor. Sometimes not even the spouse. Doctors are inevitable nuisance, but a threat for a common man. I better be nice to the doctor because God knows when I'll need the doctor. Not because I like the doctor, but because I can't help not, being in the bad books with the doctor. Nobody likes a doctor. Doctors are inevitable nuisance of the society. But then we have to accept it. And everybody says, oh, you're great, because you were available when you called. There's a story of a fellow who went to a doctor and said, Doctor, how much do you charge for consultation? He said, I charge 200 rupees. And how much do you charge for a home visit? He said, 500 rupees. He said, then please come and see my wife. She's staying at a particular place. So the doctor put him in the car and took him to the house. And the fellow gave 500 rupees and said, okay, taxi would have cost me 800 rupees. So here's your 500. So doctors are inevitable in life, and doing a GHQ will tell you in time whether something is brewing. And if something is brewing, nip it in the bud, then wait for her to send her to a psychiatrist.
So taking this opportunity, I request all of you to at least see that form on our website. It is available on DataNet.
It's an excellent idea, not just a good idea. It's an innovation. It's something that is being applied by departments of psychiatry and other departments. And I'm so thrilled that you have done it of your own initiative.
Thank you.
Okay.
It's a great pleasure speaking to you. It's time for me to shut up. There is a story of in psychiatry, you sit and listen and listen and listen. And my large part of my clinical practice is just listening to people pouring their heart out. And something similar happens to a minister in the government, a home minister who keeps on getting complaint from everybody. So such a minister once went for a talk, and he had a wonderful audience like yours, like you all. And he talked and talked. By the time he finished talking, the hall had emptied out. And the custodian was waiting at the door with the key. And the minister felt very upset. And he said, I'm so sorry. I'm really, really very sorry, but you can't blame me. There is no clock on the wall. So the custodian said, I'm sure, sir, we'll put a clock on the wall, but sir, there is a calendar. Before that, before that happens. Thank you very much for being so nice.
So, sir, Sandeep. Sandeep. Yeah. So, we really enjoyed your talk. We also learned a lot. It's not just enjoyed, but also beneath so much of, real expert help. And I'm sure there will be many more such queries and discussions over a cup of tea after the talk. But we want to thank you for coming down and also enlightening us with many, many insights into this problem. And so I would like to ask Sandeep to
Thank you.
kind of honor you with the.
Truly appreciate it. Thank you, ma'am.
Yeah, so please join for a cup of tea in the West Canteen.
Yeah, I didn't want to use that word depression because when I say depression, I just said that when you go into the real life, you'll understand that not knowing. I did say it's in a passing that people won't appreciate it. But I didn't want to use it. Was it okay, ma'am?
Mayank, this is Manchanda from 12,000 kilometers.
Yeah, go ahead.
I would like to have a recording of this, and thank you to your brother, yeah. It was a fantastic talk. I managed to catch it on my mobile, whole talk.
Thank you.
But I would like to have a recording. I hope somewhere it will be found.
There on the app on YouTube, right? Yeah, it's the same link that you have received in the email.
Okay, thank you very much, sir.